Federal funding dwindling for COVID efforts. Some health clinics here locally seeing the impacts of that. KSLA News 12's Destiny Patterson talked to health experts here in the ArkLaTex about how the cuts could affect health.
Federal funding is running low.
Eventually, you won't see those community-based testing sites. You won't see the big vaccine clinics that we have out and about in the community, especially in rural areas.
If they haven't already, patients will feel it too.
How does this affect certain communities, like you mentioned, the rural community, people who might be uninsured? Because once community testing goes away, it may not necessarily be free anymore.
Right. And so, that is, I think, the big push that you're going to see on the federal level.
Tuesday, the White House's COVID-19 response team held a briefing, noting the need for more funding.
We need more for our domestic response to stay up to date on vaccines, to procure monoclonal antibody treatments and antiviral pills, to provide protection for the immunocompromised, and to sustain our testing capacity.
The way they get their vaccine, or they may get a test, or they may get their treatments, would be more towards their doctor's offices, their FQHCs, like through our health units.
The executive director with the MLK Health Center says it's critical people take routine health care even more seriously.
And throughout this process, we've learned how important it is to take care of your health, right? The comorbidities that make people more at risk to serious complications to COVID. So we think it's really important that if you do have comorbidities, if you do have one of those chronic conditions, that you are taking care of yourself.
That federal funding package is now in the hands of the U.S. House, and officials are optimistic that it will pass. If you or anyone that you know needs resources, you can find those in our KSLA News 12 app. Destiny Patterson reporting, KSLA News 12.